Hi, Larry Stewart here with ForConstructionPros.com. Welcome to ConExpo ConAg 2020. I'm here with Michelle Walker, who's Vice President of Finance for a family business, SSC Construction out of Phoenix. Michelle, you have been involved in a suicide prevention program associated with the construction industry. Why does the construction industry need a suicide prevention program?
So about 4 years ago, we started noticing kind of anecdotally that there seemed to be a large number of construction workers that were dying by suicide. And then in 2016, the CDC actually released a study ranking construction as the #1 occupation for suicide deaths in the US.
Wow.
And it's just continued to follow that trend since then. So we assembled an organization to build that awareness in the industry and create resources for contractors to take action.
Why is construction the highest suicide rate?
Right. So there's a lot of risk factors involved in construction. Part of it is just kind of the tough guy mentality, the real stoic, I'm going to get through this, I'm going to tough it out, I'm going to suck it up and handle this on my own and not seeking help. Mm-hmm. Kind of a lack of team atmosphere, so a lot of kind of independent work or people that just kind of work together periodically, not a real team structure where people can notice warning signs and offer people help or people feel comfortable for help. And then just factors of the work itself of kind of transient in nature, so might not always be at the same job site each day, might be working out of town, variable hours, which create pressures for an individual as well as pressures for family that can kind of spiral into different issues. So there's a whole lot of risk factors, but those are a few.
Is there any association with the high opioid use in the industry?
That's the one I didn't get to, but that's a huge issue. When you look at injuries that take place in the construction workplace, and those may not be addressed properly, and so may create a dependence, or even opioids might be prescribed to deal with those, and then end up into a misuse situation. So the opioid epidemic is definitely kind of a co-related factor that we're kind of working to address in tandem, but they're both huge issues.
Not to mention those injuries can be a real threat to their earning potential.
Absolutely.
And put a person in a position where they don't feel like they're able to continue on.
All those things can really create that sense of hopelessness, and that's when suicides occur, is when there's a hopelessness of it's never going to get better. Mm-hmm. And when you start talking about somebody's employability or earning ability to take care of their family, that's a huge sense of hopelessness in an individual.
Is there experience within your company with the problem?
Thankfully, we have not experienced a suicide. Since we've started addressing these issues and learning more about it and adopting some of the practices that we've been working to put forth. I've helped a couple of people, and I've actually had the conversation with the young man of, are you thinking of killing yourself? And he said yes, and I was able to get him connected with his mom, who he was not living with, and get him connected with care. So that's it's empowering people to recognize the warning signs, helping them know how to ask that question, and then helping them connect people to care. So it's not about the industry becoming counselors or therapists and caring for people themselves. It's how to recognize the signs and how to get them connected with the care that's out there.
Yeah. So how are you communicating that message?
So we have the Construction Industry Alliance for Suicide Prevention. We formed that about 3 years ago and became a formal 501c3 about a year and a half ago. And we have a website where we have plenty of resources out there for contractors. We have trainings available that contractors can access for a very low cost and add it to their safety trainings that are already going on. We really try to build this in as a health and safety topic because that's the one advantage that construction has for it going is the focus on safety.
Sure. And
this can easily be built in as a health and safety topic. And so we have the trainings available. We have toolbox talks that companies can be doing for their daily safety meetings. Mm-hmm. A lot of things go out there to kind of help equip people to address this in their companies.
Yeah. So is there one part of that message that we could deal with right here in this video to give to viewers that would help them, equip them, at least make the first step toward equipping them to helping prevent suicide in their own businesses?
So I would say visit preventconstructionsuicide.com, read about the issue, get familiar with the issue. We ask contractors to take a pledge that they're going to stand up for suicide prevention, which stands for making it a safety topic, providing training, creating awareness, normalizing the conversation around suicide so people feel comfortable talking about it, asking for help, and then overall decreasing those suicide numbers. So, they can take the pledge, and all the resources are available there for free. The training, there's a charge, but it's minimal, and that's just through the provider that provides that online training. But it's all there for the taking, and it's just taking that first step and then working to create the culture where people feel safe to ask for help. That's at the bottom. It's a culture issue of leaders standing up and saying, this is a safe place, and if you're dealing with something that's giving you these thoughts of wanting to end your life, we're here to support you, and we can help you through it.
Yeah. Tell us that web address one more time.
PreventConstructionSuicide.com.
All right. Well, thanks so much. I wish you the best of luck with it.
Thank you.
When your dealer services your cat, they know there's a lot more riding on it than just you. Let's do the work.